been absolutely fundamental in developing the technology that we're now bringing to market and including in the services we're providing.
It allowed us to get a project off the ground that as a small SME we would have struggled to build a business case for, and they gave us a lot of flexibility and autonomy in how we went about delivering that.
What we found particularly helpful is that they first of all identified specific challenges within the NHS system via the AHSNs.
We've had several Phase 1 SBRIs and we've had 2 Phase 2 SBRIs, which are really helpful to keep us going and help us develop particularly one of our major products we sell now.
I think it's probably one of the best things that I've seen around the NHS in particular, and in terms of a funding program, absolutely the best funding program that I've ever been involved in.
Really appreciate meeting people, putting me in contact with people. We'd have to drive a lot of miles and go to see a lot of people to try and get those contacts.
It's been invaluable, and we think the SBRI program is particularly well suited to SMEs, and that it's a very intelligently designed program. It's very lightweight in terms of the governance. It's very much about identifying the essence and the spirit of what value will be delivered by a project and by a product.
The initial part of the application involved a health economist coming to talk through the program, and that helped us really focus on what our commercial case was going to be.
Without the support of the AHSNs and the intelligence provided by SBRI and the SBRI network, it would be much more difficult.
We're gradually bringing automation, artificial intelligence into supporting people stay well at home.
Really being able to support clinicians to see as many patients as possible.
Give more power to the patient and to make them more empowered, give them more of their information that we already hold about them, particularly their risk of admission, what their risk scores are, what their conditions are.
Providing a closer connection between patients and services. So we very much see digital, the promise of digital, as being blended in with face-to-face services as opposed to replacing face-to-face services.
Share a few war stories, listen to some of the things that are going on. Insights from government is really valuable as well.
Talk with other companies, meet them, understand their challenges, maybe offer advice where we've been through similar situations, and get their thoughts as well.
But it's also a really good opportunity to collaborate, to form new partnerships.
Be focused. Think clearly about what it is you're trying to achieve. Make sure there's a good financial case at the end of it. Even if you built the technology, how is it going to help you build a business? How is it going to be useful to the NHS?
Think very carefully before you commit your mortgage and your credit cards and your life to it, and try and find out who will buy your product afterwards.
Getting an SBRI project is fantastic. I think there is quite a journey after the end of the SBRI project, the SBRI funding, so it's never too early to start thinking about, having got this working prototype or this example of a system, how am I actually going to move that in so that it becomes a commercially successful product, a commercially successful piece of our business?
Just go for it. Yeah, absolutely. It's certainly as I say, it's the best funding program that I've ever been involved in.